I am Leah Tallchief. Pronouns are she, her, hers. I am with the CMEP Community Mental Health Equity Project. And we are with um, getting started with the Building Bridges series here today. It's going to be focusing on getting started with matching county and CBO needs and resources to promote equity. The CMEP multidisciplinarian team is made up of NAMI, PARS, Change Matrix, SSG, Hire, Cal, Mesa, and Beam. And this Building Bridges session is going to be led for us by members from SSG and Pyre, as well as some other community and county members.
Welcome to our Building Bridges series. This is our kickoff session, and we're really looking forward to having conversations with you over the next 4 months or so. We are starting this one off with kind of a general overview, and we're really hoping to have open dialogue today. But we do have 3 upcoming sessions in April, May, and June. We're still finalizing the dates for that, but we'll hope to send those out soon. This is really a series to focus on CBOs and counties being able to discuss county contracting and really finding a pathway to equity through county contracting. We are really looking forward to being able to see what are the gaps and needs on each side so that we can develop ways to partner together, to collaborate, to address ways that we can figure out solutions for the communities that we all serve. And we are going to do that in the next few sessions through addressing local resources, being able to talk through specific resources and needs at small to medium-sized counties to large counties, and then being able to bring everyone together through a networking workshop. So we're looking forward to that. Please stay tuned. And then, as Leah mentioned, we have the Medi-Cal 101 series starting next week. So they are 2 different series running one each month. So if you are interested, please feel free to sign up. Next slide, please. So today I wanted to start off by just thanking our presenters for being here, for taking the time out to be able to share about their experiences. We recognize that, a lot of these CBO county partnerships start with getting to know each other and having those relationships. So we've invited a panel of speakers from Fresno County to share about one specific example of county CBO contracting in Fresno County, and to have a discussion with all of you on what's possible, some things to think about for county contracting. This isn't meant to be an interactive session, so we really invite you all to be open to share your questions in the chat, and then we will hopefully have a very interactive discussion once we start off the panel. So I wanted to first start off by welcoming Dr. Gia Zhang from the Fresno Center. He is the director of the Living Well Center, and I've had the privilege of being able to work with him for the past, 6 years through the California Reducing Disparities Project. And he is joined by Melanie Vang, Ms. Melanie Vang from the Fresno Center as well. And briefly, I'll just share that Dr. Zhang is a psychologist and currently the director of the Living Well Center. He has provided, as an organizational provider contracted by Fresno County Department of Behavioral Health, their center provides culturally specific mental health services to members of the Southeast Asian community in Fresno County. And then next slide, please. And then Melanie Vang, also from the Living Well Center, as an associate clinical social worker. And she currently oversees 2 of the MHSA Innovation and Prevention Early Intervention projects. I've had the privilege of working with her as well with the California Reducing Disparities Project. and they have been able to receive county funding as well to continue that work. And with that, I just wanted to turn it over to Dr. Zhang and Melanie first to talk more about the Fresno Center and the work that they do.
Hey,
And if we can, yeah, thanks.
Yes. Okay. Thank you, Erica, and thank you, everyone, for joining us this afternoon. Again, my name is Dr. Gia Zhang. My pronoun is he, him, and his. And I'm the director of the Living Well Center and also the program director for our California Reducing Despair Project Evolution here in Fresno County. I wanted to begin by saying that Fresno County is home to one of the largest concentration of Hmong and Southeast Asian across the country, especially for the Hmong. We have over 35,000 here. This is the largest Asian group here in the county and also the second largest underserved community here in Fresno County. This population has one of the highest mental health problems because of mental health stigma, cultural beliefs, past traumas, and also lack of acculturation. Yet it also has one of the lowest mental health penetration rate in the county of about 1% here in the county. Furthermore, there's also a lack of cultural linguistic appropriate mental health services and providers here in Fresno County. And so this is the reason for us wanting to start or conduct a project like the Hmong Helping Hands intervention. And so now I'll pass over to my colleague, Ms. Melanie Vang, to share with you all a little bit more about the project.
Thank you, Dr. Zhang. And hi, everybody. My name is Melanie Vang. I'm the project manager for the CRDP Evolution. And I'll share with you briefly about our CDEPT, which is the Hmong Helping Hands intervention. With this intervention, it's consisted of 5 components, and each is based on a cultural practice and relevance in the Hmong community. These cultural practices have historically been instrumental in the Hmong community's resilience and perseverance as a minority group of people who have gone through wars, trauma, poverty, and persecution. These components included the following. So we have Hmong Talk, which is another version of TED Talk, Giteka, or we call it the cross-cultural exploration to our participants. We also have cultural therapeutic arts, crafts, and activities, and another component called Mamai, or known as Beautiful. And lastly, we also included the Hmong spiritual healing. And so with that, I wanted to also just add that, let me see, I lost my point here. For every week's activity that we incorporate within these components, we have a light cultural meal that we provide for the clients in the morning. This serves an important asset of the program as our participants view a meal as a way of respecting them and their time. So currently, our Hmong Helping Hands intervention has evolved into what we now call the Hmong Village Project. And I look forward to share our experiences with you and also look forward to your questions later on during this session. So thank you. I'll pass it on back to Erica.
Thank you, Dr. Zhang and Melanie. So we've invited the Fresno Center team here as one of the 3 California Reducing Disparities project grantees that have been funded by Innovations Funding in Fresno County. Fresno Center is one of 3 total grantees from the CRDP project, which is a state-funded mental health project. And for the Fresno Center will be talking about their strategic partnership with the county in more detail later. But if I could just take the moment to introduce Ahmad now. Jerry, would you mind pulling up the slide for Ahmad? Thank you. So Ahmad is Ahmad Barami. Ahmad Reza Barami is with the Fresno County Behavioral Health Division, and he's the Equity Services Manager, Division and Equity Services Manager. We've heard, before I even met him, I've heard his name in so many different circles about just this, how supportive he is, and how it has been so helpful to be able to work with the county in a productive and supportive way. So really appreciate his time and being here and being able to talk more about how they went about the partnership and funding these Fresno County community-based organizations for their mental health services. He's worked in county behavioral health systems for over 14 years. He's been a division manager and the equity services manager for Fresno County for the past 4.5 years. And he'll share a little bit more about how he sees working with community-based organizations, but it's been a pleasure to get to know him a little bit more through this planning for this series. So with that, I'll turn it over to Ahmad to introduce himself more fully.
Thank you, Erica. Yeah, my name is Ahmad Brahmi. Some of you may know me on this call. I've seen some of the people on the coming in and in the chat. And I'm a division manager, but I also wear the hat of the equity services manager for Fresno County. And so my team oversees, as you may have seen in that we oversee the Mental Health Services Act. We oversee the equity efforts of the department, as well as a lot of the PR relations. And we think public relations and outreach, and we think those things are all intertwined. Being able to engage our community, especially our underserved communities, making sure that we're responsive, addressing those health disparities and need to improve health equity, and then leveraging things like MHSA to try to do those. So it's a great fit for our team, being able to have those responsibilities for the department in those areas, and really being able to bring those things together to coalesce into just one effort, so they're not siloed in terms of, well, they're doing health equity over here, they're doing, like, we're able to bring it all together, including engagement and work with our community. So, and then Erica mentioned, we are one of the, and I think to this day, it's still the only county that's funding any of the original 35 CRDPs. That we were fortunate to have 3 here in Fresno. So we'll talk a little bit, I'm sure, here about how that partnership came about. But we are happy to be supporting them and not looking at doing this one time, but really focus on how do we make sure these things become sustainable within our system of care.
Thank you, Ahmad. So with that, maybe I can start off the conversation about how this got started and what does it take to have these partnerships. With that, I wanted to again remind our audience, please put your questions in the chat. This is meant to be an interactive discussion. So if things that the presenters share about this experience or the partnership strike a chord with you, please feel free to ask. This is really meant to be a kickoff session to be able to think through how do we address these partnerships? How do we move this forward? And I know that there are a lot of other California Reducing Disparities project grantees and partners on this call as well, on this webinar. So if you have tips or other questions that you feel like should rise to the surface, please add that in the chat as well. So with that, I wanted to turn it back over to Dr. Zhang to be able to talk us through just the start of how this happened.
Yeah, thank you again. When we were talking, it's very good that we had this very good relationship. And then talking with Ahmad, one of the things that he came up with, and which I'd like to expand more on, this whole idea of help me to help you. And what does this help me to help you theme? What does it look like and what does it mean? And I wanted to share that with you all today. And if I actually have a slide that I wanted to be able to illustrate. So to me, this help me to help you, it's actually it's about a relationship, and not just any relationship, but the right relationship at the right time. One that benefit both, like a symbiotic relationship, where the help me is what I need and the help you is what I have. So in our CRDP, or California Reducing Disparity Project Evolution partnership with the county, is a good example of what I've just said. So on your left, the help me was we got these 3 fantastic projects that was about to end. And we needed them to be continued because they were effective in making differences in the lives of 3 communities here in Fresno County. So we needed the fund to sustain them. So then they help you, which was what we have that is important to the county, was that we had these 3 local CRDP projects that were addressing the mental health needs of 3 underserved communities. While at the same time, on your right, the counties help me what they need, which is told to them by the community from community stakeholders, was more culture-specific mental health services like CRDPs in each of the communities that they wanted to do, the stakeholders, right? They hear this over and over again from the community say, we wanted preventive early prevention programs like CRDP. So this helped to kind of lay down the groundwork for the needs of the community to the county. Then next, the county, they help you, which was what they have that is important to us, was the funding. So they were looking for a partnership that will address the needs of the community. And they have the funding to do that. And we were looking for is funding, and we have the project to address the needs of the community. So you can see that there is this healthy symbiotic relationship between the 2 partners, and by coming together with our needs and what we have, we're able to form this very symbiotic relationship in addressing the 3 diverse communities here in Fresno County. And that is one of the reasons why I think we came about, and that was the reason why the relationship in itself came together very well. And I just wanted to kind of illustrate that. Okay. And so when we talk about what is it necessary to start? So when I think about that, I say, do you have something that I need, which is to help me? And do I have something that you need, which is help you? In this case, you can see that the county do have something that we need, and we have something that the county also needed. At the same time, you can see that the county also has something to give. And we also have something to give. And this to me was what was necessary to really bring us together, to really solve and address issues that arise from the communities, right? Challenges, and also the need for the community. So this is really, really something that I saw that we were able to put together from my perspective. So I wanted to share that. And I don't know if Ahmad or Melanie, if you want to add to that.
Well, Dr. Zhang, thank you for that. And I think, you did a really good breakdown on that. I tell, when we were discussing, trying to explain, I guess, our partnership, I right off the bat was just like, I was thinking of helping to help you. And I think I said, remember that famous line from Jerry Maguire, but it's not show me the money. That's not the approach you want to take with each other. You don't want to come to your vendors or vice versa. You can't like show me the money, but it was really like, help me to help you. Like, how can we both in the end are trying to serve our communities, right? We're both trying to help, a lot of times underserved, inappropriately served, or sometimes just completely unserved communities. And so it's like, how can we both achieve that goal? And so, when we started looking at ways of doing, continuing to support this project, we looked at we were on the time crunch, right? The funding was about to end. We were trying to figure out, will we have enough in our 3-year plan? We also had the pandemic that was at that point, I think, finally coming upon us. So we're like, okay, let's try to sort this out. And so through a work group that was facilitated by CPEN, there were some discussions, and we began to explore, could we do this as an innovation project? So the idea for the innovation project was twofold. One, would that give us the funding we needed to be able to support these CDEPs for, a couple of years till we could kind of figure it out? And 2, the figure out part was like, okay, well, we're going to need to transition these programs from being state public health funded using MHSA dollars to county funded. And for us, we wanted to use our MHSA PEI dollars, prevention and early intervention dollars. And prevention and early intervention in recent years had gone through some changes in the regulation that were requiring more specific outcomes. Like, well, what is your program? Which categories live in? What are you measuring? What are your outcomes? Things like that. And so we needed to do that, but we didn't want to just tell, for example, Dr. Zhang, like, well, you need to become a stigma reduction program and do this. Well, that's not that's not what made them effective as a community to find. And we also, and I've talked about this a lot of times, so we're really aware of that power and differential that exists between CBOs and counties. So we did not want to come in and say, well, we have the money, so I need you to do A, B, and C in order to get the money. That's not really a partnership. That's kind of condition. That's setting the conditions on how we're going to work together. What we wanted to do is truly make sure that this remained effective and beneficial for the community. And so that was kind of part of the collaboration part too, of like, okay, this is what your program is doing. It's 99%, great. We may have to make an adaptation or two in order to make sure it meets this funding in terms of whether that's certain outcomes or measures. So we don't want to change a program, but we want to see what can we add or adapt that's going to help us with the sustainability. But we didn't want to come in to tell Melanie and Dr. Zhang, well, you need to do A, B, and C. It was just like, here are the options. Here's kind of PEI, here are the regs. Where do you see your program being most effective? Where would it live best? And then based on that, what do we do as the adaptation? But it was really more of like, we're here as your consultants to assist you in whatever adaptation you and the community decide to make to help your program for sustainability. So, and I think that whole, help me to help you it kind of played out into that, because it was, I want to help you become funded and I want to help you become sustainable, because that's going to help me in having programs and services that better serve our community and more effective. And you've mastered that work through your CRDP. So how do I benefit from that? And in the end, who really benefits is not just us, but also our community. So I'm gonna stop right there, Dr. Zhang, and kick it back over to you or Melanie.
I'll just chime in by saying that Dr. Zhang really made a good point about helping me to help you, because going through this CRDP project with the Bone Helping Hands intervention, a lot of our participants have shown lots of positivity, and they have produced much better in their lifestyle and their depression and stigmatization. So they have proven that they really enjoyed these programs. And this has, given us the strength to really look into sustainability, which, we have also the connection with our community members and knowing that this is a need for them.
And I was going to say another thing you said that made me think about it too is our partnership has not only been on this program, but it's serving the community. So the Fresno Center has been a huge partner of ours in allowing us, when we're trying to do stakeholder engagement and really get community input to facilitate those. They're a trusted community partner. They know the community better than we do. So they can advise us on, well, what days, what times, what kind of incentives, what are the things that'll be a draw for people. So we're able to get and hear from the community, and the community has reiterated, hey, we want programs that are culturally responsive. We want programs that, can address our needs. And so it's not just the, our contractor partners or community partner who's kind of like, hey, this is needed, but we're able to hear from the community and listen. And I remember the very first time we were going to do the first a community planning process, Dr. Zhang, you told me, you said, like, I'm going to warn you, if we do that, the people that I bring from our programs and community, they're going to advocate for our CRDP. And he wanted to make sure, like, I knew that he's not stacking the deck. Like, that's what, and I was like, that's not stacking the deck. That's their reality. If people are involved in that program, and that is really their understanding of the program that they've benefited from, that's what they're going to ask for. They're not going to ask for us to provide a program or CRDP they've never heard, they've never experienced, or know nothing about. So it really was important, I think, having those community connections, again, where we're helping each other, to saying, let's hear from the community. And Dr. Zhang, again, completely transparent. Some of these people are going to advocate for a CRDP, so that you're aware. And so, we said, no, that's fine, let's do it. And I want to say, we've had probably like 2 rounds 3 years ago, and another one we did this year, probably our most successful community planning process for MHSA have been the ones we've done with the Fresno Center, to where first time, I think we had 80 something people in that room. And this time we had over 100 people. I think we had 4 or 5 different languages that were spoken, and so multiple interpreters. But it's really important for those community connections, because I would have never been able to get 100 people from our API, and specifically our Southeast Asian population, to a forum to openly talk about mental health. And they were able to help, identify those folks and bring them in and give us the great feedback. And it helps us all, because now we're hearing things from the community. We're looking at, hey, they were mentioning whatever particular, I'm gonna use, whatever need. And that's something that Melanie can come to me and go like, hey, you know what, is this something we may be able to explore adding into our program, or is this a gap that we can address? And we have those conversations. And so I think it's really important, if you guys are doing this as CRDPs, because your CRDPs are, as we call them, the CMAP, the community defined evidence-based practice. It is the community defined, it is community driven. So making sure that you guys have your communities involved and have your communities participate in some of those discussions with the counties, because we're, from an obligatory standpoint, we're required to have those things. But from, if you want to truly be effective, you need to listen also to your stakeholders. So we in Fresno don't go like, we're required to check. Ours is we really want to hear from the community and understand like, okay, what can we do to better support the needs? And we understand our limitations as a system of care and as an agency, and knowing that partners like the Fresno Center can do a better job working with our API, specifically our Southeast Asian community. So it's like, well, let's partner with them. And if you have a CDEP or something that, and I know there's a number of opportunities coming out now for people to apply for becoming community defined practices, making sure that you're engaging your community, engaging the counties early on in those discussions. So I'm going to stop and kick it back over to Melanie and Dr.
I guess if I could just ask, this is such a great partnership, and I appreciate being able to hear more about it. But for a lot of the folks who are attending and not knowing kind of how it started, I'm wondering, what was necessary to start it, because not everyone starts off with this great relationship or necessarily has that understanding of each other, right? So maybe from different perspectives, from the CBO perspective as well as the county, how was it started?
Yeah, for us, really, it started with us really something that I need. It goes back to the help me, understanding the needs of our community, understanding what is going on, and being able to advocate for that need. And of course, being a community here in Fresno County, you want to be able to say, well, it is the county's responsibility to also take care of its constituents. And you have a constituents that doesn't really know how to maneuver, how to advocate for themselves, or really who to talk to. So as an intermediate CBO, our job is really to be able to help link them to the resources, the services that are there. And, it's just really wonderful that you have someone at the county that is open-minded, that is culturally competent, that wants to listen to the community. And for us, it was just our way of helping the county connect the resource to the need of the community. And when we are able to kind of see ourselves, see our role and responsibility, and see the need of the community, we'll be able to connect that. And I think that's really where, any relationship start, is you have to really know your role, responsibility, the needs of the community, and be able to be resourceful and connect to them. And it's that kind of effort that led us to, resources like the county. And that's very important. If you don't know the county, you don't know your roles and responsibility, then it's hard to form any meaningful, lasting partnership at all.
I will speak from the community members' perspective, as I have more of firsthand working with them. And so again, I want to piggyback on what Dr. Shawn Ahmad had mentioned earlier about trust and credibility. Not only trust and credibility with the CBO between that and the county, but there's also trust and credibility as staff working at the CBO, connecting to the community members. And once you have that foundation built, they will come on to you and they will tell you that this is a need that they lack and that they really want to see. If there is such thing that can be, put together and to help them reduce stigmatization in terms of seeking mental health services or depression or other types of services. And so that's where we get, our answers from the community. And by gathering those answers, when you see enough of community members coming in for the same issue and for the same problem, then you know that that's an important issue to address. And that's where the connection comes in to working with the county and say, hey, this is a need that our community does not have. And so that's how we kind of work together, reciprocal relationship, to say you have the resources, but we have also the needs, and so we can work together. And this is what I see working with participants for many, many years and coming from their end.
Yeah, from the county standpoint, as far as starting out, I remember when, the first round of the California Reducing Disparity Project came out, which had some, 5 population reports, which to this day I think are really huge and still provide a lot of insights and some info and strategies that can be implemented. And when the phase 2 was getting ready to be started and being awarded, I remember Fresno had received 3 of them, but I was not working in Fresno County at the time. I was in a neighboring county. But I mean, I was familiar with it, with the programs and the whole process, the CRDPs, CDEPs. And so that part wasn't foreign. And I believe for a while now, 2 of the 3 CRDPs had already existing relationships with the county, providing other mental health services and prevention services, but not these ones. So I think that helped in a sense because, for example, the Fresno Center was familiar or a little more familiar experience in terms of working with the county. What is this county invoicing process? What are county contracting process? What are the things that, the bureaucracies, right, that they're going to have to deal with? And let's be honest, there are a lot of bureaucracies. It is what it is. So I think there was that, but all 3 of our CRDPs at different times, I don't know if it was a concerted effort. I don't think it was because they were not around the same time. They were several months apart, but Fresno Center and the West Fresno Family Resource Center and ICSI, 3 of the vendors, at different times had reached out and say, hey, we want to, talk to you about our programs and services. And I think, because my team had, as I mentioned, both the work, the health equity work, the ESM, the ethnic service manager, now we call ourselves equity service manager, as well as the mental health service act components, we were the persons I think that were just best suited to meet. And so when we had those discussions, it was just like, yeah, familiar with the CDEPs and the programs. It was more of like, do you have your evaluations? Where are you guys at? What is your program specifically doing? And started having those discussions. And I think Dr. Zhang, was really strategic and not waiting till like a week before their funding was going to run out and like at the end of the year first and be like, hey, can we get funding? He didn't do that. He didn't do the other line from Jerry Maguire, show me the money. It was more of like, again, that helped me to help you. And it was like, so we had a couple years to start thinking about, okay, how do we do this? Can we incorporate this into our 3-year plan? Okay, if we can't do that, could we do this? What are other funding options? What are the things that we can do? And I think today we have a lot more opportunities with even things like payment reform that might open it up. And at the same time, I think today we also have risks with some proposals to restructure how MHSA is. And I know for me, my biggest concern with restructuring of MHSA is that will it impact these types of programs, these community defined programs that have really been effective in serving our marginalized and underserved and inappropriately served communities. We would have never I shouldn't say that. I don't believe we would have in any span of time came up with a model that the Fresno Center came up with to address the mental health needs of our older API, Southeast Asian, and specifically Hmong population. I just don't think even if we had Hmong staff on hand assisting with that, we would do it. We needed a community organization that's in the day-to-day mix with the community and able to identify and really look at what are practices that have been effective, what are the needs, what are the gaps, and really do that. So I think it takes a little bit of as a county, understand that you don't know everything, that you're not always aware of everything that's out there, and being really open, going back to what we were talking about with Mel, of hearing what the community needs. And that's that helped me to help you, Dr. Zhang and Mel, is like, what does the community need? What do you hear? What do you know to be the needs? And, hear the gaps and hear some of the things that they had been able to demonstrate that we're addressing those and saying, okay, well, I need something that, because I want our system to be more, and when I say I'm talking about system-wide, not me personally, but as an organization, as a system of care, is like, how do we do a better job of supporting everybody in that, in our system, and understanding there's some, when we're talking about equity and disparities, everyone's not getting the same treatment. And if you gave everybody the same treatment, some would still be left behind. So really, how do we, find things that are tailored? And these were really good options for us. Again, they'd already been piloted. They'd already started doing the work. So it wasn't like you were having to lift them up from scratch. I think you guys already had, Dr. Shang, a couple rounds of evaluation. So there was a lot more, from a county standpoint, it was a lot easier to say, okay, let's follow this, because it's not an idea anymore. It's not like we're brainstorming a concept. It's like, here's an idea that's actually being put to test, being implemented, and you have something tangible that you can now build off of and work on. So.
So here's a follow-up question about what we always want to know. You get the relationship started. You're working with the county or county side, you're working with the CBO. How do you maintain that partnership?
Yeah, I think Melanie and Ahmad touched on it. It really is that trust and that belief. The county has to be able to trust and believe that they're not the expert and that there are community-based organizations and individuals in those community-based organizations that could do a better job of implementing something that is needed in the community. So I think that's important. Also, as a CBO, establishing yourself as a trustworthy, credible person, and more importantly, has an organization, for example, like the Fresno Center in West Fresno and also our other partner, ICSI. I think we have been able to establish that trustworthy and credible, in order to be able to continue this kind of program. So I think those are very key for maintaining any relationship. If Ahmad say, hey, Dr. Jean, I'm looking to do a community stakeholder of Southeast Asian, can you help with that, right? And he trusts me to do that. And if I only could call in 10, when he shows up with his staff and there's only 10 versus 100, where's the trust and the credibility goes in that? So I think those are very important things to really consider in wanting to maintain any meaningful partnership, because you have to be able to really do the work and show that you know your work and you know the community. You can bring it together so for the county to really then continue to have that trust and belief in you.
And I think, Dr. Zhang, you said is that trust, and again, going back to what you started off the presentation with, that symbiotic relationship and the help me to help you, to where we are able to then, look at, for all the reasons Dr. Zhang just explained, for them to be our community experts, them to be, the ones that if you want to use, some programs or systems will use community health workers and cultural brokers. Well, Fresno Center also functions in that capacity as one. They do that. And so we've at times been able to, we've gotten support from them that for things that they necessarily didn't have to do on their contracts. And I remember one of the big things, Dr. Zhang, was at the beginning of the pandemic. And we were trying to put, some resources and videos out, talking to the community in terms of things that they could do for self-care, things to keep, anxiety. And we didn't have the ability internally to do it in Hmong, for example. And as Dr. Zhang said, that's a large population, is one of our threshold languages. And he graciously volunteered to assist us with that and said, hey, give me the slides and I'll translate them and I'll prepare them. And he did that presentation, and it was not under any of their contracts, with nothing they were required to do, but it was more of like, no, we want to help you to help the community. So it's kind of like, help me to help you. And then it was like, let's help each other to help the community, because the community wins. And so they've been fantastic partners who regularly have, stepped in where they could and said, when we've asked for, hey, can you assist with this? Hey, can you point us in the right direction in this area? They've been able to do that. And I'm hoping that, we see time, or will continue to be able to reciprocate that to them and being able to really support them and lift up the great work that they do.
And I do want to just piggyback on what Ahmad has said in terms of the relationship with CBOs to the county. But again, relationships with the CBOs to the community members. Say our stakeholders meeting in last November was over 100 participants. And we did, the best above and beyond to really capture our participants to the meeting, because some of them had no transportation, and that was not in our contract to, go pick them up. But, we managed to do it, as you just mentioned, what Dr. Shang had given, kindly donation time to do all the work for you all. We as staff and also as CBO did the very same thing for our community members. And so it then creates that trust and relationship And again, you feel like it's a family now. If they need something, I will be there for them. So this is what we really look forward to the relationship.
Yeah. And also another key factor is that transparency. We talk about, when Moss, you want to do it, I want to let you know ahead that is it wrong for our people to be advocating for CRDP? True, that's what they are. And also, is it wrong for us to go pick them up because transportation is an issue? And how does people perceive that when we're actually transporting people to a community stakeholder? We want you to know that, is that okay? And we want to be transparent about that. And if it's okay, because just giving the barrier in our community, we want to be transparent about that. So I think, all those factors play a role in really maintaining, a partnership.
Yeah, I think you said it right there, Dr. Zhang. It is having that open communication, and we're cognizant of never promising something we can't deliver. We don't want to promise something to our CDEPs or any of our CBOs or community and not be able to deliver. And so sometimes it's up front, like, hey, are we going to be able to do that? And I may have to tell, like Dr. Zhang, Melanie, like, what, I can't promise it. I'll look into it, but I can't commit to that. Or no, I can't tell you that for sure. Or but that might not be something we can do, but what, let's meet and sit down and let's look at what some options are. And I think having those honest, open communications, so where nobody's hiding anything, like the agenda is like, we want to make this work for everyone, because when it works for everyone, it works for our community. So let's look at that. And so it's really more of, again, that I'm going to go back to that, help me to help you. It's really looking at being solution focused, like, hey, how do we solve problems? And I think, us having that trust and coming at it from that, kind of that level of transparency is just like, it's easy to solve problems then, because it's not like, well, what is your angle? It's just like, hey, this isn't working. What do we need to do? Hey, county, this is going to be an issue. How do we address it? And we start to really sit down and openly solve problems and look for that. So, yeah.
I think it's been great to hear about just how open the communication has been. And that's really based on the trust that, Melanie, as you mentioned, the trust that you have with the community, and then the trust that you have between each other, so that you can actually ask those questions when you're uncertain about things, or if there are things that are coming up, so that you can be open and you're not trying to hide anything. But because there is that trust, you can problem solve together, right? You are solutions oriented together. And I think that's difficult in terms of a level of trust to achieve. And so it's really great to hear about. I know we had a question in the chat, so I know, Michael, I don't know if you want to unmute right now and ask your question directly.
Yeah, thank you. I was just in the process of typing out a long question. But anyway, so my question is, what if there's a need in the for a particular community and there is none that is being identified, none of the CBOs identified yet that serves that particular community? And what do the county do? Does the county help form a CBO, or I'm just curious. Where do you go from there?
Yeah, I mean, we wouldn't form a CBO, because that's the whole thing of having an independent, nonprofit organization, or it could be for-profit setup, is to have that separation. We can, as an entity, we can set up a program and try to staff it with members of the community and do something like that. But we wouldn't necessarily set up a CBO. We would potentially set up a program, and maybe in time it may be something that transitions. We usually will put out things like a request for proposals, request for qualification, or application to see if there may be other CBOs that are interested. The only drawback with that is if you don't have a local CBO, a community-based organization, for people that are not happy with my acronym soup, it is that if I have a community, and you guys, I know there's some CBOs on your CDFs here, like if Dr. Zhang was going to go to, I don't know, Monterey County and be like, we're going to come in and do programs for your API. We're an entity that has served API. Yeah, they may have that expertise with the population, but they don't have that local expertise. They don't have the local connections. And so we could put it out, but we would be maybe apprehensive of having someone from another area try to come into Fresno, provide services for that community. Doesn't mean we wouldn't. So, I mean, we would potentially look at it as something we could lift up. If there is no providers, do we look at maybe bringing an outside provider? And some of it is also just developing those things, working with our community, organizations or even groups that are interested. And those are some things that I know myself in Fresno, but I want to say several other counties have been exploring of how do we put together tracks for community stakeholders who are interested in addressing certain needs of becoming a CBO. So how do you, basically how do you become a 501c3? How do you contract with the county? How do you become a Medi-Cal managed care provider? How do you do those things so that you can start creating opportunities for more interested community stakeholders to start creating those organizations, CBOs, and be able to do that work. So that's, that would really be the case. We wouldn't necessarily, like I said, lift up, but we will try to do our best to support interest in becoming CBOs and really try to develop and expand the capacity of CBOs. And what we've tried to do is promote some of the opportunities that have come from DHC's Department of Healthcare Services with their latest efforts for funding for new rounds of community-defined evidence practice programs. And so there have been some CBOs that work in different sectors, but are maybe not contracted with us. They're not affiliated with us, but they do work in the communities. And we've tried to share those leads with them, say, hey, this is something that you're interested in. This might be something that might, appeal to you, sharing those funding opportunities with them. And if they do follow up, we're always happy to connect them to our CDEPs, the Fresno Center, West Fresno, and ICSI, who are experts in really doing that. Say, these are 3 local people who put together a CDEP. If you want to talk to them, they can give you a little more. We can definitely share our strategies in terms of, hey, if you're going to go for this and you're looking at sustainability, think about these things, because these are the things that we're learning from our work, for example, with the Fresno Center right now as an innovation project. Like, hey, these are things you need to plan for sustainability. These are things to keep in mind. So hopefully that answers your question.
It does. Thank you. I, as a follow-up to the question, I was wondering whether Fresno County has a program that kind of trains or teaches the community in the process of advocacy.
We actually have a couple of organizations that are specific to patients' rights and then family and individual advocacy. The advocacy is more along the lines, I would say, of helping people better understand the system and their rights. The advocacy is more along those lines because we can't use necessarily our public funds to do things that could be deemed as like political advocacy or lobbying. I don't want to say political advocacy, but that could fall into the area of lobbying. But we do have, we work with Reading and Beyond and Centro La Familia here in Fresno that actually provides some of that advocacy work and supporting people in understanding their rights and doing some of those types of efforts. We've looked at could we create something like you said, a track where it can be helping CBOs or even people who are interested in becoming CBOs, again, how they can do more of that work. We also have community partners like NAMI who also do a lot of that work. But then we also regularly work with our stakeholders here, like the Fresno Center, who they will have 101 and 100 plus of our community members who come out and also speak out about what they need and what we can do better to support their services, support their service needs.
All right, thank you very much.
Michael, I'll just also point you to the comment from Trang in the chat about we did have a recorded session on advocacy for CBOs and also for others from AAPI Equity Alliance in Los Angeles. And so that should be available on the CMEP website.
I want to touch on your questions. You never know when a crisis, what a need may arise in a community. So I think it is the role and responsibility to some extent of the county, or to some extent to even CBO, to be ready for that partnership, to be able to address that in the community. And we have an example of our partnership, one of our CRDP partners in Sacramento, where you have a new crisis, a new need, where you have a new wave of refugees that came into town. And so now with that, how do you now as a county, and who is it that you're partnering with the community that can address that new needs in the community? And this is something that I think, as a county programs, you're always looking for partnership, who in the community, who are the community experts that can best address that particular needs, and so that's very important to always kind of know. And so as a CBO, I always say you want to be the community expert, and you also want to be able to be flexible so that when whatever needs are there, you're the right partner for the county to work with.
Thank you for adding that perspective, Dr. Zhang. There is another question in the chat from Steve. Could you speak to using responsive funding mechanisms to allow smaller organizations to avoid county purchasing process using a fiscal sponsor approach? Any experience and success?
We have not done that to date. We do have some specific protocols that the county does have purchasing. I know the city has done something similar with some with one of their agencies receiving grants and then working with fiscal sponsors to support entities that were not 501c3s yet that could not contract with the county. The county does have some really specific requirements on insurance, on liability, things of that sort. So for a vendor to utilize a fiscal sponsor would be like that fiscal sponsor would also be taking on all those additional insurance requirements. For example, things that risk management requires. We did do an evaluation, an independent evaluation about 1.5 years ago, using a third party to really look at our procurement process, our purchasing process, and looking at, are there things that we're doing that are, how shall I say, are we doing things that are resulting in us not getting as many smaller community-based, culturally specific CBOs applying for services? Or is it that there's just not that many? Or is there other things that we have that might be systemic and structural that have excluded those CBOs in the past? And so, you know, that was an extensive work that was done by the third party, and it found, you know, 2 parts. One is we just don't have the volume or the number of CBOs in Fresno County that are doing behavioral health type work in the community, so that, you know, there isn't as big a pool to draw from. But then there was also feedback that, you know, that procurement process can be really difficult and very bureaucratic. That does make it hard for some CBOs to pursue that. You know, if I have a staff of 3 people and 2 of us are doing direct work and one is kind of keeping the books and doing that work, and now in order to meet all the county requirements, we're going to need, you know, 8 people to do all this compliance and all this work. Well, do I have enough money to then do this service? So we've actually taken that and really been utilizing that in influencing also some of our work that we're doing with payment reform through the CalAIM, looking at that and really cognizant of making sure that our efforts around CalAIM do not end up excluding some of our smaller CBOs, and so utilizing that procurement process. So we haven't done that yet, so I can't say if we've had success on it. I know the city has done some work around that. They've had some success, but they've been able to use a really large entity as kind of that fiscal sponsor. And I think that entity, and Dr. Zhang may know, the Fresno County EOC Economic Opportunities Commission has set up basically arm within their organization to be able to provide that kind of support to CBOs to be able to be that fiscal intermediary, provide some of those, you know, insurance, some of those things, but we haven't done that yet.
Thank you, Ahmad. So I want to continue to encourage folks to put their questions in the chat, or you can raise your hand and we can call on you to directly ask your question. I know that there is another question in the chat, but maybe before we can get to that one, if you could share maybe some of the highlights of this partnership and the work that you have done together. And anyone can start.
Can I jump in on that one real quick, Dr. Tangameli? I've been able to go to a number of it was a grand opening and other events that the Fresno Centers had for the Hmong Helping Hand and the Hmong Village Project. And I like to eat, and boy, have I ate well at those events. So that is absolutely one of the big highlights for me, was going over there and being able to just partake and eat in the food. But, and I say that seriously, the food has always been delicious. But I would say is the major highlight for me is not even been necessarily with specific project work, but it's really I feel having a trusting relationship now with the Fresno Center to where I feel I can call on them and they can give me an honest response or answer. Hey, can you help with this? Yeah, no, we're slammed right now. We can't. And vice versa, that I hopefully feel that they know that when they reach out to me and they ask me a question, I'm going to do the best I can to solve that problem. I'm going to do the best to come through for them. And if something cannot be done, it's not because of a lack of effort or desire. And so I think the highlight for me is really that trusting relationship that is built to where we really can work well together to support our community. And again, I've ate fantastically at every one of those events.
Yeah, thank you. I think for me, my highlight really when I look at it, it's just really going beyond the partnership. And it becomes more like a friendship. And when you go from partnership to friendship, then you could do things that are not just within your contract. When you're asked to say, hey, can you help me with this? Can you help me with translation? Can you help me with this? Or I said, hey, Ahmad, you have any data on this and this that I need to do this? And you don't need, like to go through any chain of command to be able to do that, but to just now be like a friendship where say, yeah, I can give that information. So I think to me, I felt that the transparency of the partnership had allowed us to become better friends in addressing issues and needs in the community. And so be able to tell a better story of really what's going on in the community and what are the needs in the community. And then hopefully that all reflected in the yearly 3-year report that we put together. And so I'm just happy that just from one partnership, it just inspires so many different ways of us working together to make a difference in not just only one communities, but in all of the communities here and Fresno. And I know that the county is now afraid now to say, now I have all these different partnerships that I could go to address all these. Well, let's talk about all these different issues, even though, you know what, it's a very needed issue that is not in any particular community, but I can bring in all these organizations, CBOs together and be able to solve or identify solutions for that. So I think those are, to me, highlights. Yeah.
Speaking from participant views of highlights, I think that with having so many people coming to the stakeholders meeting for multiple years and being able to be part of these URDP projects and ongoing, this gives them that trust and that relationship, and to be able to voice their concern at stakeholder meetings versus in the past, they're very reserved, very shy. They're not as well aware about stakeholders meeting, but now that when we give them a call and say, hey, we have a stakeholders meeting coming up, we need you to set aside your time and come to this meeting because it's very important. They will see that as a priority thing, and they will then make the time to come to the meeting versus if they didn't have the trust and we weren't as, credible to really gain their trust, they would just, say, oh, I'm not available, I will not be able to attend. Or they would just say, oh, yeah, I will come to the meeting. But then on the day of, nobody shows up. So I want to give, a lot of credits to our community members that through their participation, they have also shown and grown a lot with CBO learning about the county and the behavioral health, helping them to resolve a lot of their stigmatization and depression. So I really want to just highlight that.
Yeah, and I want to add something to that from the participants. Imagine this, you have all participants who look like Melanie and myself, who over 100 of them coming together. And you know what the highlight of that is? To see someone that is different from them, like Ahmad, like the deputy director from the OHI, who came down, right? And they saw these people and they said, who are these people? Who are these people? Who are these people? We said, these are the people that care about you. So it's not only us that care about you, but now you have other people who are different, who are here to look at you to see that they want to say they care about you. And I think those are also highlights that we miss. But from the participants, to be able to see people who are different than them, that are there showing the support and caring and like their food and take pictures with them, that's very powerful from the participant's perspective.
No, thank you so much for sharing that. I think it is really building, the title of this series, which is Building Bridges, because I think we are all here because we want to serve and help the community. And I think being able to break down some of the barriers that may or may not be there, but that, we perceive because we don't have that trust relationship, because we aren't working in partnership. And maybe before we move to the challenges section, we can take the question from the chat, which is kind of a challenge, which is a major challenge. From Stephanie, has there been any consideration around putting out infrastructure grants so that CBO can build their ability to apply for county contracts?
So a couple of things on that one. We haven't done that yet. As a county, we really don't like to use the term or put out funding in terms of grants. Because for grants, usually it's like, hey, you've got the money, spend it down, use it or lose it type of thing. And with the county, it's like, well, these are, we have that fiduciary responsibility, right? These are taxpayer dollars. We need to make sure like you're not spending now, but you're actually spending on what is needed. So that technicality, like we don't use grants, but we have looked at as a result of that evaluation, like I said, that we had done of our procurement and purchasing process, and really looking at, what are some of the barriers, and some of the things are just historic systemic. Some of it are just not being responsive to the changing, landscape. And so one of the things that we have looked at is potentially, could we create, and this would probably go beyond just, we would probably spearhead it, but we would want to go beyond just, our department, but bringing in maybe our partners like public health, social services, and creating like a no cost for our vendors, like becoming a contracted provider 101 type thing. So it could walk everyone from like, if you're just a concerned stakeholder, what would be your first steps in becoming a CBO, a 501c3? What does that look like? How do you put together a board? Once you do that, what are going to be some of your requirements you'll need from the county to contract? What are some of the requirements we have? Like, these are insurance requirements. These are the risk requirements. Walking them through, how do you do an RFP process? How do you put that together? How do you secure, the funding? And so we would want to try to create something that would have a structured, I don't want to say course, but that, that CBOs are, and again, not even CBOs, but somebody that's just interested. Melanie's like, you know what? I want to create my own company to do whatever. Okay, come in, you can go through this at no cost and really learn, and bringing in, the different experts that can really speak to those areas and provide that training, technical assistance to the community so that they can become a CBO, or maybe they form themselves into CBO to do some work, but they're not really sure, like, what's the next step? How do they pursue contract funding? How do they pursue grant funding? How do they become a Medi-Cal provider? Things of that sort that we could provide those. So absolutely, those are things that we're looking at. Everyone is busy and there's never a good time. I get that. For counties right now, it's like, I can just speak for our team. We're doing with like finishing up our MSSA 3-year plan and a number of innovation programs. We're also trying to get everything together for CalAIM, the payment reform that's going to start, July 1. In Fresno County, we're also transitioning to a new EHR, electronic health record. And so for us, it's just like, hey, this is a year where we've just got a lot of stuff coming our way. And so we're trying to get those things done. But I know my team does plan in the future, hopefully in the next year, to really look at exploring that question in the chat of setting up some type of a process, no cost course, funding the opportunity for people to go from like, hey, how do I go from having an idea to really becoming a CBO that can pursue funding?
I don't know if Dr. Zhang and Melanie, you wanted to talk about maybe from the CBO perspective about being able to build your ability to apply for county contracts or for county funding.
Yeah, I think for this particular funding, I think it's difficult to be able to do that. I know that there are other, grants or foundation grants that are more, supportive of startup. Sometimes if you are a program and you get funded by the county, sometimes county do allow a startup in terms of physical, like getting your facility ready. They may want to work with you on a one-time budget to be able to, develop your facility, get it in place in order to implement that. That is something we, were fortunate to be able to do to start a program like ours. So yeah, there are opportunities like that, but then that's once you get it, then those are negotiating as well.
Thank you. So again, just reiterating that if you do have questions, you can feel free to put them in the chat or raise your hand and we'll be, you can unmute and ask them directly. So we've talked a little bit about one of the challenges, which is infrastructure issues, but and funding, but I'm wondering if you could talk a little bit beyond the highlights, what have been some of the challenges of, working together or CBO county partnerships and how you overcame them.
Yeah. I think for us, you always have to anticipate challenges that are beyond our control, right? And that is, the process in itself. Sometimes, we were expecting to start, or we were told this month or this month, but the process on the other end is not within our control. And so we have to be able to trust each other and be transparent on whether or not this project is going to happen or not. And I mean, when we work with the county, especially with Ahmad, this is a program that we, did all the paperwork and started, way in April and May to get it ready for the fiscal year in July. But because of all the process that we have to go through, we didn't start until November, December to really get it. And it's like 7-8 months later. And then be able to say, how can we still recover? How can we still be able to finish our tasks and be able to meet our goals? How can we still work together? Because we're anticipating July start, and now we're in October and November, and when we're not sure if we're going to be funded or not, right? So I think those are some of the challenges. But again, it goes back to trust and transparent to say we can work together to do that. That's one of it. And another challenge that beyond our control is staffing. I'm very blessed that Ahmad is someone who is committed to the job, to the county, the community. I have staff that are committed to the programs and the project that have been here for 5, 6, 7 years. But then those only a few of us. And then there are so many other new staff that came on board that had no idea what CRDP is. That, like even our local evaluators from the state and the local has no idea, or even if they do, they don't want to know about it, and they want to do something totally new. And we have to say, oh, do we have to really restart the wheel when the wheels are ready? Yeah, we wanted to create another wheel. We want to make sure if it runs that way. And we have to be able to trust that and overcoming some of that are things that we're working now, on how to best implement and evaluate problems like that.
And I do want to add that with the challenges, not only with CBOs and the county, but it also puts challenges on the community members. When they know that there's a program pack coming out already, that they're the ones who voice to make it happen, they want to get into it ASAP. And then having to wait on the process, they've been waiting once we've already shared with them that, we're going to start the program. And then we keep telling them, oh, it's not ready yet. We're going to have to wait another month, 2 or 3. And down the line, they're like, are you serious? Are we having this project? Are you just like telling us something different? And so having that relationship and that trust again is something that you really need to have, telling your community members to be patient and to wait until the process is really in effect so that you can then conduct whatever program and whatever activities that you need to be doing. So we had to do that. And a lot of our participants were patient and understandable, but we had a few that were, quite upset. And we had one that sadly, he was waiting for the evolution project to start. And unfortunately, he passed. He passed last year before he even enrolled into the program. So these are some of the challenges from the client's perspective, waiting on the process.
No, thanks for sharing that. It's very real, right? The challenges that you're facing and what it really means when there's a delay, right? That it's not just a delay of missing certain time, but that there are actual impacts on the community members as well as the staffing and moving that forward. It's not just the data, right? So Ahmad, did you want to add from the county perspective?
I mean, if I was to say a quick highlight is I think just the the fact that the work that our three CDEPs have been able to do and together, but I think it's really been more than, because again, like I said, our model is more of us providing the TA to them in this process of doing what you're doing and how do we adapt it to become something that we can sustain with MHSA funding. But I think, their work, them working with the evaluator, them working with us, them working with each other, them working with the community, all the things they've done has really helped lift up, I feel, the CDEP models. And I think, advocates and people that are supporting the CDEP and advocating for that and speaking about that can give an example of like, hey, you know what, we have these 32 other CDEPs, that we know are doing some really great work. And here's a model we can give you of where a county CDEP partnership is working, right? So I think that's a big highlight. I think it's really helped to support the cause and case for continuing to include CDEPs into consideration for a lot of the work. I mean, the biggest challenge I see is, and I think this is just life, I think in county behavioral health land is right when you think you've got like something solved, another curveball comes at you or they throw something else at you. And so for us is as have about 1.5 years left with this project and we start to, wrap up and look at how do we transition these to being funded through, a different part of our MHSA plan. We're also now looking at some proposals statewide to revise the Mental Health Services Act and to restructure the Mental Health Services Act and to kind of change some of the priorities. And we do have, that's a challenge because I think how do we potentially have to navigate that and still support these programs that are really serving those underserved, inappropriately served and historically marginalized communities, and this funding stream, whether it's innovation and really long-term at the PEI component, prevention, early intervention component of MHSA has been that tool that it was envisioned to be transformative, to really close the gaps and address the needs of our community. And so I think, there's examples of PEI programs up and down the state that are really impactful in terms of addressing those health disparities and addressing the needs of those marginalized communities. And so our challenge now is planning for and then having to have contingency plans of what happens if something changes. How do we make sure we continue to support these programs in our community? So that becomes a challenge I don't have to solve today, but it is a challenge that we have to very much have on our radar and be thinking about.
But it's really helpful to know that, that there is that proactive thinking, the understanding that it isn't just about that one-time funding short term, but that it is sustained funding. It is about continuing to support these programs. I think it's also helpful to know that this is, just want to reiterate for those who are attending this webinar that, we have these amazing speakers from Fresno County, and this is just one example of a CBO County partnership. The other two organizations that are funded in Fresno County under the Innovations Grant is the West Fresno Family Resource Center and the Integral Community Solutions Institute. And they are also California Reducing Disparities Project grantees. And so I just wanted to think through, there's a question in the chat from Carlos about, do you have resources for us being an established CBO in terms of next steps for us to secure funding for services we have been providing? That touches on some of what we've talked about before about, how should CBOs, how should counties go about securing this partnership and providing those that funding, the services. So we'd welcome your thoughts on that.
I'll say this real quick, and then I will turn it over to Fresno Center because they'll have I think a unique perspective too as being the CBO. One, you got to be looking at diversifying your funding options, especially with the inception and implementation of CalAIM, California Payment Reform, that allows a lot more services to become something that is Medicare. To be able to utilize the Medi-Cal funding that allows more services to be available than were in the past. Today, Medi-Cal only allows you to bill for X amount of services. Under CalAIM and Payment Reform, a lot more services will be available. So I think looking at that, looking at how you can leverage those, so that you're not going again to whoever your funder is and say, hey, I need the entirety of this program funded by you, but saying, hey, you know what? this is what our program costs. These are ways that we're diversifying the funding. And what we need from you would be, X amount. And I think that that really helps, is if you can find out ways to diversify your funding. Developing, as we've been saying on this webinar, developing those relationships. If I have a CBO who I've never met before comes up to me and says, hey, we're interested in getting funding for a service, I'm going to tell them like, okay, well, here's the info for purchasing. You will need to contact them and get your name put on their list. So whenever there's an RFP, you'll be notified, because that's legally all we can do. But if you're at least forming those relationships, like, hey, we'd love to share a little bit about what we do. Okay, hey, these are some things we're doing. These where we're putting. So I'm at least aware of it. And then when an opportunity comes up and you guys apply, it's a lot more fluid in terms of hey, I'm familiar with what it is that you do, what it is that you're looking for, understanding that you're looking at really how do you continue to serve the community and diversify your options versus you're looking at going back to the Jerry Maguire line. Are you saying help me to help you? Or are you saying show me the money? If it's show me the money, that's probably not going to be the most effective way, because I don't say that counties don't have money, but our monies at this point are so tied up in a lot of programs and things like that, that it makes it hard for us to say, sure, let's fund something new, unless we're putting out a brand new RFP. So for us, as we did this innovation plan, we had to each year look at how do we free up money so that when this program ends, we can make sure that we're funding it through those process. So it's been looking at a couple of years of, hey, okay, are we going to move this one? Hey, can this be funded out of something different and free up this one? Hey, can this particular program draw down more Medi-Cal so that it can offset the cost, which means now I can shift this money for these CDEPs. So because it's going to be hard for a county just off the bat to be like, sure, let's just start funding. They have money tied up in a lot of things. So that would be like my advice, is build those relationships like we've been talking about. Really think about like diversifying your options. Find out, you can get that information ahead of time. Find out from the county, what are the contracting requirements? Like, hey, can I see a boilerplate? Can I see what all the insurance requirements are going to be? Can I see all the things that are going to need us, so you can start looking at what does that process look like for you? So with that, I mean, we can get into more details, but that would be, I think, its own like webinar training. So I'm going to stop there and defer to Dr. Zhang and Mel on some of their perspective.
Yeah, I agree with diversifying the funding, recognizing that, for Cal AIM is Medi-Cal, then under MHSA, looking at innovation funding, PI, as well as CSS. Those are all different funding sources that one could look at. Another thing is really to also be proactive, be ahead of the game. That is being involved in community stakeholders meeting. And you need to be there up front early on, because if you're going to be advocating for something now, for something that has already been the plan for the next 3 years, likely, that's no matter how ready you are, it's gonna be tough, because, the 3-year planning's already been in place, and that's what they used as a guide to fund for the next 3 years. And so if you're in the middle of their 1 to 2 years, certainly, keeping that advocacy going is great. But then usually it's best to be able to be inputting into the community stakeholders, so that way, you would be able to position yourself for any RFP that come out. So those are different ways that I see being able to help with next steps.
Thank you so much. So I know that we shared a lot of information, and I really am grateful to our presenters, our 3 presenters, to be able to share from their perspective about a little bit more about their experience working together. And I hope it's, opens up the opportunity for you all who are attending to be able to think through ways that you can partner. If you are a CBO with the county, if you're from the county with CBOs in your region. This is just the first webinar of 4, and we look forward to hopefully having more interaction and be able to continue this dialogue in the next 3 webinars, especially our last one focused on networking. But wanted to see if there are any final comments before I turn it over.
Just final thoughts that I just wanted to share. I just have 2 that in the course of my working here that helps with building relationship with county. And number one, as a community-based organizations, you have to see yourself as a community expert. And if you're not, you need to be. We'll find the people to help you become the community expert. And that's very important to establish that credibility and trust. And then the second thing that I think I learned over the years, if you're not at the table, right, the MHSA process allow and needs you to be at the table. And if you're not at the table early on, then forget about the later on. And this is something that's very important that I think all CBOs and community needs to understand and be able to bring folks and community at those kind of meetings to really determine, what kind of programs and projects that are needed in the community. And that's so important. And if as a community-based organization, you cannot do that, then, it's going to be hard to really form any meaningful partnership. And I just want to say that in closing.
Yeah, I was gonna say, to what Dr. Zhang said, I think it's really important if you're don't have a partnership, or even if you do have a partnership with the county, to be involved in those. So, counties have those MHSA community planning process and forums. Come to those, listen in, provide input, be a part of it, be seen so that, they become familiar with you and what you do. If there's community needs assessments, get involved in those, provide responses, provide that input. If your county should have things like, work groups, committees around diversity, equity, and inclusion, quality improvement, things like that. If you're not at the those are open to the public, and just be involved there so you can hear what's going on. Like Dr. Zhang said, you might be able to provide input or think about, hey, they're addressing, there's a gap here, and they're talking about nobody does that. Well, we do that. How do we now, protest? So you're really proactively involved early on. That's one of the things. And the other thing I'll leave everyone with is maybe just a bit of advice is reach out if you can to whoever's the technical term is ethnic services manager, but a lot of us go more with terms like equity services manager, diversity services manager. So reach out to those folks in the county. Every county has somebody assigned to that. Now, most counties don't have the luxury of having just a full-time person doing that, but there's somebody that wears that hat and role, because they're the ones that can really look at, potentially could these community defined evidence practices be something to close the gap to address some of those disparities. So I would say reach out to them, and as Dr. Zhang said, reach out and just become familiar with who the MHSA coordinator for your county is. In some small counties, it's the same person. The same person who's the MHSA coordinator is also the ESM. And in those counties, I actually think while they have a tremendous amount of work, those are probably going to be your greatest allies, because they're looking at both the health disparities and the challenges and the lack of culturally appropriate services. And they're developing the plans to look at how do we use MHSA to close those gaps. So you've got those people that are capable of kind of bridging both worlds. And so I would reach out and try to, again, don't reach out and say, hey, I want to meet to tell you why you need to fund me. But more, hey, we want to just let you know who we are, what we're doing. This is something, hey, we're a CDEP that's funded for a couple more years. Hey, we're a community organization that's trying to do, and just be on the radar and be familiar and start, like Dr. Zhang said, build those relationships and really go from there. And hopefully those relationships not only result in partnerships, but they really benefit your community, which I think, we're starting to see that in Fresno, our partnerships with our 3 CRDPs, Sweet Potato through this West Fresno Family Resource Center, the work with ICSI, the work with Fresno Center and the Hmong Helping Hands. Those are benefiting our communities. The people are actually benefiting from those. And so that's your ultimate goal in the end.
And so once again, thank you to all our presenters and the panel and all the attendees.